every Sunday. You're the first page I turn to, just so you know. I didn't see this question, though. A lot of us are cooking for the holidays. We are told to wash our fruits, wash our vegetables. What about washing our turkey?
Do not wash your meat. You know, the only way to get rid of the organisms, the bacteria on the turkey, is to cook it. Washing it only increases your risk, and I'll tell you why. When you wash it, the water that splashes from the turkey gets into on your hands, on the top of your desk or whatever. I mean, not your desk, on your utensils, and then you touch it. This can cause infection. There's a warning out. It came from England, actually. They find that 80% of the women or people who cook turkeys, for some reason, wash it with the delusion that they're cleaning it. If you have this compulsion, take a damp cloth and wipe it over the turkey. Do not allow the water that's sprinkled from it to get in all over your kitchen. The other thing is, the only thing that will make the turkey safe is cooking it. And you've got to cook it to at least 165 degrees. It's got to be very hot. Before you eat it, I do this. I do all the cooking, as you know, Eric, in my house. My wife is a lady of leisure, and I do all the meals and so on. And when I cook a turkey, I cut it in its thickest portion and make sure that there's nothing pink left. You've got to cook it so that the entire turkey is white and no liquid coming out of it. Anything else about?
Well, you know,
I
sometimes spray like Fantastic or something to try and kill the germs. In other words, I'm doing the wrong thing.
Eating turkey makes you sleepy because it contains a certain chemical that it does contain, but it contains it in such small amounts that eating the turkey does not make you sleepy. What makes you sleepy is the rest of the huge meal.
Eating all the sides. Yeah. I wanted to ask you about this. Speaking of eating, I didn't get to eat this morning, and everybody heard downstairs my stomach growling. Yeah. Why does that happen? That was a question that we got from a viewer.
They've all been talking about it. I came in and said, why is your stomach growling?
Wait till you hear Jamie.
You know, the thing is that it's gas, and you get gas.
No.
I'm sorry to tell you, it's gas. And we get gas in two ways. Gas gets into your bowel in two ways. One is from swallowing air, which makes its way down through the intestines into the bowel and so on. And the other is the digestive process. The foods, many of the foods you eat are digested by the good bacteria. The food has to be digested, but in the process, it makes gas. So,
all right, enough already about the gas.
In order to reduce the amount of air that you swallow, never drink from a straw. Don't chew gum. Don't smoke. People who have sinus problems or regurgitation swallow a lot. That's where the extra air comes from. As far as the digestive process, make sure if you have a lot of gas, I want you to check tomorrow to see whether you're lactose intolerant. Some people can't digest the lactose in their food, in their dairy products, and they form a lot of gas too.
All right, I'm going to feel better.
But one thing about it,
reason, Eric, it happens to you too.
Yeah,
please tell me.
I can testify to that. But I want to
have a good meal, and your stomach won't growl.
But I want to tell you that the growling and the gas formation is not harmful. It's a natural phenomenon that some people, like Eric, actually have more than others, but it won't hurt you.
All right, have a good meal, and then you won't be growling. Here's something. Your mom ever tell you, when you read, have a light on, and don't read in dim light, it'll hurt your eyes? Well, some U.S. researchers say that could be a myth. I can't believe, doctor, that reading in low light could be a myth. I mean, I've worn glasses my whole life.
No, reading in the light is not a myth. I mean, there's definitely not a myth. But reading in dim light may tire your eyes, may give you a headache temporarily, may make it difficult to read, but it does not harm the eyes permanently. So if your child reads in dim light, you don't have to warn him or her that it is going to damage the eyes. It does not damage the eyes. It can make them uncomfortable temporarily.
Well, that's good to know. No damage.
You know, there are literally hundreds of them that people and some doctors believe. For example, I'm sure you've heard that you've got to drink 8 glasses of water a day. And that's nonsense. That was based on a research report that came out in 1945 in which they said you have to have 2.5 liters of water a day. But the other part of the report that nobody listens or knows about is that that water comes from the food that you eat, from fruits and vegetables and other foods that contain liquid. It comes from soft drinks and milk. Anything that's liquid goes into that eight glasses equation. So the point is that if you think that you've got to drink 8 glasses of water a day and you keep drinking it, that is harmful for you. That can be harmful, especially if you're in heart failure. And the other thing is, Einstein is quoted as saying that we only use 10% of our brains. Nonsense. You use every cell of your brain 24 hours a day, even when you're sleeping. I think that originated with people who wanted to push some products that they said would make you smarter because you're only using 10% of your brains. You're using all of your brain. However, use a cell phone, especially in an intensive care unit, you may be disturbing other people with your conversation. But in terms of whether the cell phone itself interferes with defibrillators or monitors, it does not.
That's interesting. I bet we're going to get a lot of email on that. We'll see you next week and check up on that. Fascinating. Let's go back to the email now. Charlene Cushman says that she's never had chickenpox, but her husband and his family, well, they've had shingles. And Charlene would like to ask the doctor if she's at risk of getting chickenpox if her husband gets shingles. And why would there be a connection?
So what do you think?
Same type of virus thingy?
So you think she is at risk or is not at risk?
I vote for yes, and what do I win?
And you vote for?
No.
Not at well. She's a doctor's wife, so she knows. Well, you happen to be right.
I guess.
You happen to be right, and she happens to be wrong. When you get
this segment's brutal today. I have gas and I'm wrong. Go ahead, doctor. Take it away.
When you get the chickenpox, after the skin rash clears up, the virus stays in your body and it goes up and sits down and until for the rest of your days into nerve cells along the spinal cord. Later on in life, and many people, as they get older, and maybe their immunity goes down or whatever, the virus is reactivated, travels down to the skin, and forms the rash and blisters. Those blisters contain the chickenpox virus. And if your husband has those blisters and you in some way touch them or are exposed to them, you will be infected. But you will not get shingles, you will get chickenpox. So you get chickenpox from somebody with shingles because the chickenpox virus is in the shingle rash. And shingles is not a disease, a different disease. It's a different form of chickenpox.
So I'll never get that one wrong again. You're supposed to take your medicine, you're supposed to finish your medicine, but there is one pill that you should take at the right time of day, but not others, Dr. Rosenfeld. Which is it? Well,
this is just one item that I want to discuss. Many people, they're given blood pressure pills, maybe 2 or 3, and the doctor says, well, you take these pills every morning. If you do so and you find that your blood pressure remains high, instead of increasing the dosage every morning, you should take at least one of these blood pressure pills at night. Take the others in the morning and take some at night. That's because normally during the night, blood pressure drops about 10 or 20 points in normal, healthy people. In some people with high blood pressure, the blood pressure does not normally drop and, in fact, may go up. So if you have high blood pressure and it is not apparently responding to the medication you're taking, take some of that medication at night. Chances are your blood pressure will come down.
That makes so much sense. 8 hours a night, you don't have the pill.
Well, a lot of these blood pressure pills are supposed to have a 24-hour action. So if you take it in the morning, theoretically, it should work all night. And it does work all night. But if you take it at night, chances are much better that it will normalize during the night.
All right, Doc.
All right, and of course, today is Sunday. It's Sunday house call, not Monday house call. But we'd like to have you around Monday. We need